The main complication of atrial fibrillation is stroke. When the heart is fibrillating, the atria do not contract efficiently, and blood tends to staunch in the upper cardiac chambers, leading to the formation of thrombi that can easily come off. While traveling through the blood, these thrombi may reach the brain and occlude an arterial vessel, causing a brain damage, stroke. The risk of stroke is 5 times higher in people with atrial fibrillation compared to those without. People older than 65, and especially older than 75, women, subjects with hypertension and diabetes have to be particularly careful, as well as all those with prior strokes and coronary artery disease and vessel disease. Other relevant complications linked to atrial fibrillation are heart failure, 3 times more, dementia, and higher mortality rate, 2 times more. Clinical practice has identified different types of atrial fibrillation. In relation to its duration, atrial fibrillation can be paroxysmal. It ends spontaneously in a couple of days. Persistent. It lasts until a cardioversion is performed with restoration of normal sinus rhythm. And permanent. The arrhythmia persists or repeatedly recurs despite cardioversion, and its presence is accepted by both the patient and the physician. According to its symptoms, atrial fibrillation can be symptomatic or asymptomatic. In the first case, patients present the typical symptoms of this arrhythmia, while in the second case, they perceive no symptoms at all. Silent atrial fibrillation is a very risky condition because the patient is not aware of the presence of the arrhythmia. Indeed, suffering from it without being aware of its presence severely increases the risk of stroke. As mentioned before, atrial fibrillation is the most common arrhythmia. But how many people suffer from it? According to estimates, about 600,000 people suffer from it in Italy. With 60 to 120,000 new cases every year. In the USA, there are about 3 million people affected by atrial fibrillation. And between 300,000 and 600,000 new cases every year. This means that 1 out of 100 people suffers from atrial fibrillation. These are impressive numbers and demand greater attention to the problem, especially considering that they relate only to known cases. If we take into account also the cases of silent atrial fibrillation, these numbers would nearly double. This large-scale phenomenon has not only social but also economic consequences. In Italy, the average cost for every single patient per year burdens the state treasury with about €3,200, with the effect of sending the total national expenditure up to nearly €3 billion and €300 million per year. In the USA, the average cost for every single patient per year reaches $20,700, with a total national expenditure of about $6 billion per year. Therefore, fighting atrial fibrillation is not only a commitment for the individual, but also a mission for the national healthcare system.